Hello everyone, it's Dr. Alessandro. Welcome back to my channel. Please like and subscribe. And this video, this is a continuation of the video on orthodontics, that is, doing braces. Now, in some cases, we encounter situations where just doing your traditional braces or even Invisalign, that is the clear trays, that is provided by the orthodontist and guided by orthodontic care, is not quite enough. That is, the issue doesn't necessarily lie with the way the teeth are positioned, but it's really where the jaws are positioned. So sometimes we can have a situation where the lower jaw is out in front of the upper jaw, or the upper jaw is way out in front of the lower jaw. And in cases like that, your traditional braces, they'll straighten the teeth, but they're not going to help the way the teeth come together in a bite. So the bite could remain very damaging or just minimally or non-functional. And so in situations like that, it's going to take more than just braces, because braces are going to be a part of the solution, but it's actually going to take surgery. And what I'm going to tell you, I'm not going to go into all the graphic detail because I've seen a lot of these surgeries when I was doing a one-year residency program. But what I'm going to tell you is this: what can be done. So a surgery can be done if you need these upper teeth to expand outward and overlap the lower teeth, that is, extend beyond the lower teeth. You can cut all of this and then reposition the jaw, and then even make a cut here on this part of the jaw. And then you can separate and move the upper jaw around into the spot which will work best for the bite. So that's one type of surgery that can be done. The other type of surgery, and again, I'm doing this very basic for everybody, is to actually cut along the jaw and reposition the lower jaw into a more optimal position. So you can cut along the lower jaw, basically back here behind these teeth on both sides, and reposition the jaw in a manner which, again, suits for the new bite, so that the bite is functional and it's not a damaging one. So those are some of the surgeries that can be done in order to correct what's called a skeletal deformity. That is, it's the bones and the way the bones developed that were the issue and not the teeth. Here's the trouble. The surgeries are very involved. They're very intense. It takes a lot of planning, it takes a lot of time, and they're pretty expensive. So those are some of the downsides. Another downside, and I have to tell you this because I've seen it, is that when just after surgery, when you come out and you're recovering from surgery, from this kind of surgery, if you choose to do this, you will be very swollen. It's going to be very uncomfortable for about a week. It is pretty dramatic. It is pretty graphic and dramatic. So that is something you have to be prepared for. Somebody even used the phrase, you look like a beach ball, and you do get very swollen. It is pretty accurate. But here's what I'll also tell you. Months later, when we were doing our follow-ups, we would ask each patient, hey, was it worth it to do this? Each and every one said absolutely yes. So they were thrilled with the result. It made their function much better, so they could chew their food normally, and it wasn't tough to do anymore. And their look changed, their appearance changed. And that's another huge, huge psychological effect, of course. And it was a great benefit to them. So I would say that, yes, the surgery is extremely beneficial. If it's planned right and done right, it's fantastic. But keep in mind the different downsides. There are some downsides. And of course, there's always risks to surgery, so you have to keep that in mind as well. But all in all, it is something that you can do if the issue that you have isn't necessarily a tooth position issue, but really a jaw development issue. So that is it. Thank you so much for joining me in this video, and please like and subscribe, and hope you're staying well and healthy.